Good morning. Good morning to you, to Lazaro supporting us from the television studios, and I ask to be permitted to remove my face mask. Good morning also to our colleague translating the briefing in sign language. She's always with us, and although some may not realize, is always there for our hard of hearing viewers, who are many. And good morning to all of you, our viewers, who tune in every day. Today, 181 patients continue to be hospitalized in Cuba. 5 are under observation. There were 129 suspected cases and 47 confirmed active cases. In our primary healthcare system, 254 people are being monitored by our professionals and specialists. Yesterday, our molecular biology laboratories processed 2,714 samples to detect the COVID-19 virus. 928 were processed at the Pedro Curi Tropical Medicine Institute, 658 in Havana's Hygiene, Epidemiology and Microbiology Center, 283 in Santiago de Cuba's, 252 in Villa Claras, 383 in the Hermanos Aimajeras Hospital Laboratory, 146 in the Genetic Engineering and Biotechnology Center Lab, and 59 in the Civil Defense Laboratories. Of the samples processed yesterday, 13 tested positive for SARS-CoV-2 and COVID-19. This brings the total number of samples studied in Cuba thus far to 234,817 and confirmed cases to 2,462, representing 1.05% of all samples processed. Yesterday, samples were processed from all of the country's provinces. The highest number in Havana with 2,000. 60 were processed in Cienfuegos, 81 from Holguín, 138 from Santiago de Cuba, and so on and so forth from all the country's provinces. The 13 positive samples are all Cubans. 12 are confirmed case contacts, and the source of infection is being investigated in the other. These 12 confirmed case contacts bring the total number of people to have contracted the virus from a previously diagnosed case to 2,136, or 88.3% of all positive cases. Like I mentioned, we are working to establish the source of infection in the other case diagnosed yesterday. This takes the total number of cases where it has not yet been possible to determine the source of infection to 114, or 4.7% of all cases. 170 people, or 7% of all cases, contracted the virus abroad. Of the 13 cases yesterday, 6 are women, for 49.6% of the total, and 7 are men, for 50.4% of all confirmed cases, meaning that 1,242 men have tested positive for the virus in Cuba. 8 of the 13 was asymptomatic, for a total of 1,348, or 54.7% of all diagnosed cases on the island, while 73.3% of confirmed cases in the last 15 days have been asymptomatic. Those affected were between 20 and 40 years of age, followed by under 20s with 4 cases in this age group, then those aged 41 to 60 with 4 cases. Of those under 20 years of age, 2 are female, aged 9 and 19, and 2 are male, aged 5 and 16. All of these children are from, well, let me start by saying that of the 13 confirmed cases yesterday, 12 are from the province of Artemisa, and 1 is from Villa Clara. All 4 cases under 20 years of age diagnosed yesterday are from the municipality of Bauta in Artemisa, and all are confirmed case contacts, and are all asymptomatic. The one confirmed case in Villa Clara, and let me just stop here for a minute because I know the population have been keeping track of case numbers in all the provinces, and there have been no new cases reported in these two provinces for a while. For example, Villa Clara recorded its last positive case on May the 18th and Artemisa on May the 28th. The patient from Villa Clara is from the municipality of Placetas, where they were tested and the positive diagnosis confirmed. The 12 cases from Artemisa all belong to the municipality of Bauta. All of the cases in Artemisa are linked to an outbreak after measures were violated. Meanwhile, as I mentioned before, the source of infection linked to the case in Villa Clara is still being investigated. The 4 positive cases under the age of 20 bring the total number of confirmed cases in this age group to 281, of which 274, or 97.5%, have been discharged from hospital. The 4 children diagnosed with the virus yesterday are all clinically stable and were asymptomatic at the time of testing. As such, this brings the number of cases... no new cases were reported in Havana yesterday. And I mention this because we always expect there to be cases in Havana. But the measures that are being taken in the capital by the defense councils and provincial and municipal councils are proving effective, and this is showing in its case rate. As such, let's turn our attention to the confirmed case rate per 100,000 inhabitants over the last 15 days across the country's provinces. With the 12 confirmed cases yesterday, Artemisa has a rate of 2.52, the highest in the country today. Havana's rate continues to fall, standing at 2.15 per 100,000 inhabitants. With the positive case yesterday in Villa Clara, this province now has a rate of 0.13. As such, Cuba has an overall confirmed case per 100,000 inhabitants rate of 0.54. Of the 2,462 diagnosed cases in Cuba, 47 continue to be hospitalized active cases, representing 1.4% of the total. Of these, 46, or 97.8%, are clinically stable. The status of the critical patient from Havana, who is being treated at the Dr. Luis Diaz Soto Military Hospital, reported yesterday, remains unchanged. However, despite being critical, the patient is stable. There have been no COVID-19 related deaths in Cuba for the last 10 days, a positive statistic. 87 fatalities have been reported on the island since the pandemic began, for a mortality rate of 3.53%, compared with the regional rate of 4.01%, meaning that Cuba continues to place 21st in the Americas and 110th in the world. As we always mention, 2 cases were evacuated. 5 were discharged from hospital yesterday, a negative ratio when compared with the number of positive cases diagnosed yesterday. 2,326 people have recovered from the virus to date, or 94.5% of the total. As I always say, some from a clinical standpoint and others from an epidemiological one. Some are in quarantine at home, others have been given a clean bill of health and have returned to their normal daily activity like work and study. In the world this morning, we watched the statement given by Dr. Carissa Etienne, Director General of the Pan American Health Organization. She was very concerned about the evolution of the virus across the world and in the Americas, which continues to be the epicenter of the disease. Nonetheless, as of midnight last night, as we always state, COVID-19 continues to be present in 185 countries. There are currently 14,684,832 confirmed cases of COVID-19 worldwide. Yesterday, 208,103 new cases were reported. And what's worse, 4,131 people died of the virus, for an overall total of 610,110 fatalities, for a global mortality rate of 4.15%. The region of the Americas, which represents over 50%, well, in actual fact, it represents 53.26% of cases worldwide, reported 111,110 new cases, for a total of 7,822,205 confirmed cases. Unfortunately, 2,145 people died of the virus yesterday, for a total of 314,013 COVID-19 related deaths in the region, representing a mortality rate of 4.01%. The United States continues to be the country with the most COVID-19 cases in the world and in the region. Yesterday, it reported 56,750 new cases, for a total of 3,830,010 confirmed cases, and 140,906 fatalities. Next is Brazil, then India, Russia, South Africa, and Peru among countries with the highest number of cases. This is the information we have today on the virus in Cuba and around the world.